Rooted in a dedication to improving health through the empowerment of the community, Grand Island Regional Medical Center aims to bring additional patients and healthcare talent to Grand Island. Of the 15 doctors involved in the initial conversations about building a second full-service hospital in Grand Island, Dr. Ryan Crouch and Dr. Tom Werner played a major role in leading the effort starting back in 2014.
I'd say several years ago, there were a whole group of doctors that just felt there was a need for additional services here in town, and we had several meetings together to try to decide the best way to approach that. And at the end of the day, as a group, we decided what we really needed was a hospital to act as a center for our ideas, and I think that's kind of what got the ball rolling with this.
The doctors felt that branching out to a new hospital would restore local control to the community.
I think the importance of locally owned and operated is essentially that the decisions are being made here. We can determine a need for our community and quickly bring that need to the community. When it's not local decisions are not being made here, it may be a year, 6 months before those services can be provided.
The physician-led hospital not only provides more hospital care to Grand Island, but it also allows for options. Events of 2020 helped solidify the decision to form the Grand Island Regional Medical Center.
A lot of the healing in medicine is dependent upon emotional support, family support, community support, and I think we can provide most of the things that people need in the local community here at our facility and do it in a supportive environment. And when you ask what we can provide here at this facility compared to sending someone to Lincoln or Omaha or some tertiary referral medical center, is we can offer the chance to have people be here at home with their family, with their friends. When I talk to people about the need for hospitalization, I have a great deal of warm reception from patients, that want to come out here and try the services. I think there's a lot of community excitement about us being open and being fully open and ready to go to serve the community.
The medical center was designed with patient care at the core. Physicians were adamant that the facility incorporate the natural landscape of Nebraska within the hospital's design.
I think the environment of where we are, the energy that's brought by letting the outside in, the sunlight, it brings energy not just in the healing process, but it brings energy to the employees. And the employees with energy are more likely to be excited about what they do. That energy flows into the patient's care and the care of the families. Just all around positive benefit to having that positive energy.
When reflecting on the origins of Grand Island Regional Medical Center, Dr. Crouch compares the care system to the culture of growing up in a small town.
I grew up in a town of 1,000 people. And in a town of 1,000 people, you know everybody, you're friends with everybody, you bend over backwards to help take care of your neighbors and your friends. That's how we got our start. We were small. We were a cornfield a few years ago. Just like a small town, we sprung up out of the cornfield. It was our community that asked for this facility, and we built it on that structure. And I think that sense permeates through the system that we've built here.
The leadership at Grand Island Regional Medical Center is working to create a relationship with surrounding areas and believe their success can be a model for other central Nebraska efforts.
We've gone out of our way to connect to the local medical community, not just in Grand Island, but in surrounding communities, to try to build the medical community in all of central Nebraska. I would hope that the community of Grand Island at large can look at that and say, we can expand this concept to other areas.
Dr. Ryan Crouch and Dr. Tom Werner, not letting circumstances define their patient care. The Chamber's 2020 Outlier Award honorees.